Ladies and gentlemen, I'm very glad to be here this evening to be at your function. I was looking at the list of speakers that were speaking earlier today. I wish that I could have been here, but there are a few other functions that I had to attend on my way to getting here. By the way, today in Fiji is National Sports Day. So have you had your 30 minutes of sports or exercise? As doctors, you have to make sure that you walk the talk and start doing it. So I was thinking to myself that I'd get you all to do 30 push-ups, but I won't do that. Your theme for today has been espoused by Dr. Fatiaki, is about NCDs. NCDs is a great tsunami that threatens to just roll over the Pacific Islands. It's one of our greatest challenges that we have. So the fact that you're discussing this is something that I'm very grateful for, because it's something that we're grappling with here in Fiji. And you're all doctors. I'm not a doctor, so I'm not going to talk about the technical aspects of NCD because you're experts and I'm not an expert. But as a government minister in charge of health in a country, in a region where the rates of NCDs are so high, I'm very grateful then to think that you're talking about this, you're sharing knowledge. Because if there's one thing about knowledge, most other resources in life, the more that you use them, the lesser they become. You use your money, the money disappears. More that you use a resource, it disappears. But knowledge is the one resource that the more you use it, the more it grows. So the fact that you're sharing knowledge here today means at the end of this conference, the knowledge that we have will have grown. So that's a great thing to see. At one time, in my layman's understanding of NCDs, it was seen as a disease of the Western countries, diseases of the rich, those that had more money. But today, NCDs don't distinguish between the rich and the poor. They don't distinguish between the different countries in the world. And I think our big concern here in the Pacific and in Fiji is the fact that it is affecting those who are younger. It's beginning to touch the lives of those who are the youth and the young that here in Fiji. Here in the Fiji and the Pacific, NCDs have taken a firm grip on our population, and it is shaking us to our very core. The challenge for us, as I said, is not so much about NCDs in general, but the fact that it's moving down to the younger, to the population. And if we look at the growth in our population stats in the Pacific, we still have a very broad triangle. A lot of people that are young, and it tapers up to the top. But the projection in the future is that it's going to go like this. That it means that more of our people will become older. And when you have more that are older, and the breakdown of the population, that is going to bring its own problems for us. Over the next few years, our population distribution shapes are going to change from a broad-based triangle to one in which a greater proportion of our population will be much older. This change in the future population distribution brings with it its challenges and the complication. As the distribution of the population changes, as there are more old people who have to be looked after, and if we have a workforce like we're faced now with Fiji that is getting sicker with NCDs, we have more problems to deal with. And that's the challenge that government is looking at. So I'm very grateful that general practitioners are looking at this problem, because hopefully we'll be able to work hand in hand to deal with this issue. In government, one of our major focus in dealing with NCDs in health is to deal with it at the primordial level, at the very basic level, to minimize future hazards to health, to see how we can have an impact on society, to inhibit the establishment of factors, whether they're environmental, economical, social, behavioral, or cultural, that bring about, that are the broad health determinant that prevent personal exposure to risk factors. That's one of the major exposures things that we try to do in government, to try to do that. We have in this country developed policies to discourage smoking. We have taxed cigarettes highly. We have stopped people smoking in public. We have smoking in public areas, in public transportation, to try to create that environment so that people don't get the NCDs. We have also tried a big focus of government is improving sanitation, improving water supply to people so that they don't get sick. Housing, there's a strong focus in Fiji on dealing with the squatter settlements. Now, the highest population densities that we have in Fiji are in the Suva-Lami corridor, where people are flocking from all parts of Fiji. They're cramped together in crowded conditions, and when you have that, it leads to disease, it leads to ill health. So that's a great challenge that we see. If we can address these big problems, we can have a big impact on the health of our population. We're focusing on establishing healthy communities with the resources that we have, supporting early childhood activity, and also promoting physical activity. As I said, today, when I left Suva, I attended a nurses' conference. Then I visited some of the areas where all the civil servants in Fiji are playing sports and competing against each other. Because it's a message that we are pushing across strongly to Fiji, to everybody in Fiji, that you need to move, to activate your body, to use it up so that you can become healthy. And also, one of the important things that we're doing in the government is promoting nutrition, get people to eat the right kind of food. Our modern challenge today, everybody has easy access to high energy diets, and we have sedentary lifestyles. A lot of people just sit and watch TV for a lot of the time. One of the most important, fundamental, and most challenging behaviors that we have in Fiji for the NCD crisis intervention is eating behavior, which is why this is very interesting, because we've just had a cocktail. Now we have this, and after this we start eating. Primordial change also requires, change at the bottom requires change in socio-economic status of society. And that's something that the government in Fiji has been focusing on. In the past few years, one of the biggest problems that you have in trying to lift the socio-economic status of a country is political instability. And this is something that has beset this country over decades. Political instability based on people looking at not what our commonalities are, but the differences among people. We have had racial systems of politics where people are segregated into different groups and people are brought up to see themselves as different. It was that basis of looking at the differences among people that led to all of our problems in the past. Our problems of 87, our problems later on, our problems of 2000. This thinking that as a country we could not see ourselves as one country, but as isolated different groups of people. That was one of our greatest challenges. That is why we needed the constitution that we put in place in 2013. A constitution that forced everybody to see themselves as part of one country, where we can all see ourselves as Fijian, so that for the first time we can have a democratic system where one person is given one vote and each vote has an equal value, so that we can have true democracy. That is the basis. If we do all other kinds of things, if we do not deal with that, first of all, ultimately in the future we'll have the same problems over and over again. So that was one of the reasons that we had to have the issues of 2006, to bring about the Constitution of 2013 that now sets us up, gives ourselves a base to build sustainability in our economy so we can lift the socio-economic status of this country. And on that basis, we should be able to touch all of the other health matters. So I think that is one of the important steps that has happened in Fiji. And building socio-economic status, as I said, is one of the important things. And it's been proven. This year will be the 5th year, if all the predictions come right, it'll be the 5th year that we'll have consecutive economic growth in this country. That has never been achieved ever since Fiji became an independent country. If you set your basics right, it'll come through. The confidence in the economy. So I'm seeing now, as you see, if you walk around, if you drive from Suva to Nadi, you'll see there's economic activity everywhere. There's building and construction going. There's a building boom. When you set your basics right, when you get everybody in the country to see themselves as one, moving forward in a common direction, that is what you will get. We're hoping to be able to keep that going stronger into the future, because as I said, socio-economic status, it has an inverse correlation with lifestyle factors like smoking, abnormal food patterns, and exercise. If you can raise the status, we believe that you'll have a good impact on people. So I'm very glad to hear about the interest of the general practitioners in the area of NCD. And I would say that on behalf of the Ministry of Health, we welcome this. We look forward to working hand in hand with the general practitioners in efforts for NCD intervention to improve primary and secondary care and expand this to primordial care. And in the Ministry of Health, One of our focus at the moment is to introduce wellness in settings through motivational interviewing in terms of nutrition, physical activity, mental health, alcohol and tobacco. One of our major focus this year is on screening. We know with the incidence of NCDs going up, one of the targets that we need to do is identify where likely hotspots will be, where the people that are likely to have this and have some early intervention. This year, the Ministry of Health intends to screen 90,000 adults, to be able to screen them. That screening, I think next month, if I'm not mistaken, July, will be the NCD month. That's correct, eh? And say, oh, Diabetes Fiji is sitting right behind me, yes. It's 90,000. So that's why earlier this week I met with Diabetes Fiji, and they are willing to work with us on this screening. So I think this is a good example of how we can work together. Government, civil society, general practitioners working together to try to address this scourge of NCDs. The Ministry of Health has also introduced a panel model for primary and secondary levels of care where screened adults are color-coded according to heart risk. They are then managed using the protocols, and the GPs, general practitioners in Fiji, can also add synergy to this. We are very appreciative of the efforts of the general practitioners in Fiji in particular in our free medicine initiative, and we hope that this collaboration can continue and only grow bigger and stronger. We invite more general practitioners. I know a lot of you are involved in other activities related to health outside your practice, and that is something we welcome and I applaud and appreciate greatly. I met a few outside who were here from other countries who have been doing surgeries in Lambasa as part of a group that comes in. And once again, I take my hat off to practitioners who do that. I applaud that. I don't know if Dr. Vijay Kapadia is in the room, if he's here. Is he here somewhere? Tomorrow. Oh, he's going to be here tomorrow. So I applaud the efforts that people that have been in Fiji, have left in Fiji and come back, and they're doing something about our heart disease and cardiovascular. I take my hat off to all doctors who do that. We in Fiji welcome that. We hope that there can be more of those sorts of things. The ministry, so we invite all GPs to join organizations like the Alliance for Health, the Cancer Society, the Heart Foundation, all advocating for Fiji to become a healthier place. I believe that general practitioners have a role in palliative care. That is something that has been sorely lacking in Fiji, something that we need to focus on. And the ministry has also prepared the World Health Organization training package on mental health gap that is now available, that will be made available to GPs to increase their skills in diagnosis and management of mental health problems, because this is a hugely under-recognized and under-reported problem that we have in this country. GPs have a role in family practice, in looking at families and addressing increase in childhood obesity. NCD and GP is about practice at primordial, primary, secondary, and tertiary levels of intervention at the public health facilities of family level of practice. There is, of course, I believe, that if we are going to have an impact on health, it needs a whole of government approach, not just the Ministry of Health, but we need to work together with other arms of government. But not only in government, it requires a whole of society approach. Health is such a big problem. It requires a more systemic approach. We need approaches that cut across sectors. And I recently attended the World Health Assembly and talked about some of the major problems that are impacting on the world. Some of these major problems, the major one for us here in the South Pacific is climate change. And I think in terms of health, climate change has a big problem for all of us. We face the daunting challenge of a future in which the world might become uninhabitable, where people could perish. That's a huge challenge for us. And the globe, the world, needs to do something about that. And hopefully when they get together in Paris in December of this year, the governments around the world will decide to do something about that. We have huge challenge in things like universal health coverage, to make sure that health care can get to all those who need them and not just be limited to those who can afford them. These are great challenges that we have around the world. We have the great challenge of antimicrobial resistance. The challenge that very soon in the future, diseases that we have been able to deal with through antibiotics, if all those antibiotics lose their power to deal with those diseases could come back and start killing people. All of these major challenges, it requires collaboration and cooperation. Maybe on the global stage, it requires cooperation amongst the different countries. But that is the same thing that we bring to our own situation here in Fiji. If we're talking about NCDs, I believe that the way forward is through collaboration and cooperation. Government with other stakeholders, government with civil society, government also with general practitioners. So we look forward to ways in which we can work together in order to address this great scourge that we have, so that we can leave Fiji, leave the world better for those that follow us. At least prepare, do something, work in collaboration, in cooperation, to put in together programs that will allow us to leave a better Fiji for those that follow us. So I look forward to the deliberations that you have for tomorrow. We look forward to the outcomes of that. Hopefully there'll be some good suggestions, some good thoughts that come up to see how we can work well together, government and the general practitioners, to build a better Fiji and deal with the NCD scourge that we have. I'm sorry, I apologize to my Australian friends. I've been focusing largely on Fiji because I'm Minister for Health for Fiji. But once again, I welcome you all to Fiji. I hope that you have a great knowledge-building exercise. Make sure you spend a lot of money in Fiji. We need it to grow our tourism economy. And I wish you a great and successful symposium and conference tomorrow. Nawale.